Hi everyone, my name is Ali Raza. I'm the founder and CEO of Max Dental Marketing. And today we're going to be talking about how to leverage negative feedback that comes in for your dental practice. Now, why is it necessary to listen to unhappy clients or to pay heed and attention to negative reviews? Because negative feedback will reveal specific areas of improvement within your dental ecosystem. It'll help you uncover hidden issues that could affect overall patient experience. And it gives you a chance to turn that negative experience into an opportunity. Whenever you have a list of patients who are set up for appointments and they're coming in and leaving outside, you want to have a mechanism in which your team or the dental practice owner in the ideal world should be able to get some sort of feedback, be it negative or positive, from every patient who has received an experience from your dental practice. The key is to ask open-ended questions, because if you ask closed-ended questions, chances are you will not be able to get the deep experiences that are in the minds of the customers or the patients. Example questions. How was your experience with our dental team? What do you appreciate most in our service? Where do you think we can improve? If I'm the business owner, I can ask questions like, would you want to tell me something that was not so good about my dental practice? Even when the patients are done with the process, they can leave them for their home, and then you can ask feedback if it's not an appropriate time for them to give the feedback when they are in the dental practice. Only 5% of dissatisfied clients typically voice their concerns. Rest of the 95% of the folks who got a negative experience will not voice their concerns. So these people who are actually voicing their negative concern should be really paid attention to, because more people will inform their friends and family about a negative experience rather than giving direct feedback. How dangerous is that for any growing dental practice? When you get a negative review, just ask yourself, is this feedback valid? What can we learn from this feedback? How can we contact the person or the patient to get more detailed about what exactly happened? When you get this information, you want to dig in more. You want to see where the person or the patient came in from, what was their source of engagement, who was the person who gave them the treatment, what was the scheduling like, what were any possible issues, when was the billing done. Take a complete look at the picture and then try to see how to solve the problem. Usually there are two types of fixes whenever you get a negative review or a negative experience. Number one is the quick fix. The quick fix is, if there is an issue with the procedure, you want to get in the patient again into the chair and treat them with whatever service is required. Number two, the long-term fix. You want to figure out why the problem took place at the first place. You want to see the issue and then fix the possible policy or the process or the system that created the issue in the first place, so that more such issues should not be created in the future. Engage with past clients. These are the clients who came into your dental practice and got a procedure done few months back, or maybe few years ago, because they have completed the entire dental process. They came in, they scheduled, the onboarding was done, you gave them the procedures, they left, and then they have an overall experience about how your dental practice serves a patient. These types of patients can provide long-term insights. You want to understand both positive and negative experiences to push forward holistic development and holistic improvement of your dental practice. Your front desk staff should be able to give you the list of these types of clients, because they are the ones who get to listen to the experiences of a lot of patients who are either coming into the dentistry or walking out of the dentistry, or receiving feedback on email, text, and phone. When you do this, there is something that will happen, that can happen, and that is, you might have patients say, oh yeah, we forgot about your dental practice. Yeah, I think it was good. Yeah, never mind, I'll come in again. When that happens, This is an additional source of patients that you can get from these type of surveys, but that is not the objective of this activity. The objective of this activity is to get negative feedback or any critical feedback so that you can make adjustments to your dental practice. You want to identify all the potential clients who engage with your dental practice, called you, emailed you, tried to fill out the form, but did not end up scheduling an appointment. Your front desk staff is again the best team to get this information. Questions to ask from such people: why didn't you choose to book an appointment with us? Was there any issue? Was pricing a concern? Was the service a concern? Was the procedure a concern? Would you like to give us any additional information on why you chose not to use our dental practice? Did you choose someone else? And if yes, who? Or any other additional piece of information that'll help you understand why you were not the choice of that patient and why that patient chose some of your competitor to get their dental treatment done. What are the key benefits of conducting these types of surveys and gathering these feedbacks? It helps you improve client experiences and patient experiences. It addresses feedbacks to ensure a better experience for future patients. It gives you an opportunity to identify the types of training that you need to get done for your staff, because if your staff is messing up at any point in time, the patients are giving the best feedbacks with which you can identify the areas of training for your staff. It is a great idea to communicate any changes that you made in response to the negative reviews to your patients so that you can showcase the commitment to improvement within your dental practice. Gathering negative feedback is not a one-time thing. It's a repeatable, recurring process that you would want to run every now and then to gain actionable insights into what your dental practice is doing right and what your dental practice is doing wrong. Whenever we get a negative feedback, you don't need to dread. Just relax, see why it happened, see the validity of that negative feedback, make changes accordingly. Identify a few clients and patients this week and reach out to them for any negative feedback. Ask open-ended questions so your patients can speak up their minds and give you valuable insights that you will never be able to gather from any other sources. That's it. Stay tuned for more information and more action and tips to take your dental practice to the next level.